All right, we're going to get started. Thank you so much for joining us tonight for our webinar in honor of National Volunteer Month. Each year, NORD has over 1,000 community members that are volunteering with us in support of our mission. And tonight we have the pleasure of hearing from 4 current volunteers that will speak about their experience engaging with different programs and activities that NORD offers. Before we hear from our first panelist, please ensure that your mic remains muted for the duration of the presentations. And if you have a question for the panelists, you can submit it through the Q&A feature. The Q&A feature is separate from the chat, so you're welcome to use the chat. It's an interactive chat. You can introduce yourselves and connect with other participants. But if you have a question that you'd like the panelists to answer, you can put that in the Q&A. This webinar, as I mentioned, is recorded and it will be posted on NORD's website. And we'll email the recording to everybody that attended and registered, hopefully within a week of this webinar. And then this webinar will conclude at 8. We'll really try to stick to that time to be respectful of everybody's time. And with that, I'm going to introduce our first, or I'll go on to the next slide. Just share our mission. Our mission is to improve the health and well-being of people living with rare diseases by driving advances in care, research, and policy. Our speakers tonight, we have Lily Emmanuel, Irfan Patel, Abigail of Villarreal, and Tammy Jones. And with that, I'm going to introduce our first panelist. We'll first hear from Lily. Lily is a rare disease patient who has been partnering with NORD Running for Rare since 2021. She graduated from high school in May of 2023 and plans on starting college at the University of Colorado, Denver this coming fall. She'll be majoring in biology and hopes to one day become a medical practitioner researching rare diseases. And Lily will be presenting on her involvement with NORD's Running for Rare program. Lily, please take it away.
Hi, everybody. My name is Lily. So just a little bit about me to get started is, I'm from Denver, Colorado. Some things that I enjoy is I really like running. That's a picture of me at the Denver Colfax Marathon. I've done the relay and the half marathon, and it's just something I really love to do. Picture next to that is my dog, Norbert. I love taking him on walks, and I love to talk about him whenever I get the chance. So yes, had to include him. So I'm a rare disease patient, and what I have is I have Ehlers-Danlos syndrome. So it's a connective tissue disorder. It's often known for hypermobility and joint dislocations and pain, but there's also a lot of other complications. So the way that it affects me is I have intestinal dysmotility. So I have a feeding tube and a central line for my nutrition and hydration. Then I have like cardiac and venous complications. And one new thing is that it's very common to have long COVID with Ehlers-Danlos syndrome. So those are just some new personal things about me. So yes, so I'm presenting on NORD's Running for Rare. So it's NORD's signature running program where runners train throughout the year to complete a race of any distance. They partner with community partners who are rare patients, families, or advocates, and they help to fundraise and raise awareness. The goals of this program is to build relationships between the runners and community partners and share rare resources and create a platform for stories to be told, stories about the community partners and their experience. So I have been a community partner since 2021. I'll talk about it a little bit later about all the people I partnered with, but I got really into it because I am interested in running, but I just thought it was a crazy coincidence that it's something about my 2 interests, but yeah. So first partner, I've partnered with Tyson Fetzer for the Boston Marathon in April 2023. So I was really excited to partner with Tyson. We bonded a lot over running, and I got to talk to him a lot through my last some 2 semesters of high school. So he gave me kind of just a lot of encouragement and motivation throughout those times. I started talking to him around like September 2022. So those are a few pictures of race day. He also came to Vail, Colorado for a wedding. So I got to meet him in person before the marathon. I drove out to Vail and got to go hang out with him, and we just went on a walk and talked. A cool thing about Tyson is that he works for Generate Biomedicine in the supply and manufacturing. So it was just really cool learning about his work because I am interested in going into medicine in the future. So it was just really cool to see kind of the other side, the supply and manufacturing side of medicine that I hadn't known about before. So, oh, also before, sorry about 1 second. Before I move on to the next slide, is that QR code right there is actually a QR code that takes you to the fundraising page that Tyson and I made. It's just kind of a good platform to learn about more about his story and kind of our relationship throughout those few months. So if you're interested, you can follow the QR code, or I think there will be a link in the chat. But yeah, okay, now I'm ready. Okay, so then next, my next and most recent partners were Philip and Abby Maderia. So this was for the Marine Corps Marathon that happened in October 2023. So the Marine Corps Marathon is in Washington, D.C. So Philip is actually the founder of Running for Rare. So it was really a very fun opportunity that I got to have to partner with him and his daughter Abby. It was really great because I got to partner with Abby, who gave me a lot of advice about just university, and she was kind of like, we talked about reading and hobbies, and she gave me a candle, and it's sitting right over there. So I really appreciate that. But so Philip is currently a site head at Lonza Cell Gene Therapy, and Abby currently works at Vertex Pharmaceuticals. So it was kind of just getting to talk to them more about like the medical scene that like different sides of it that I'm really interested in. So we've had a lot of fun conversations, but when I got to go to Washington, D.C. for the marathon and meet with their family and just sightsee, it was really fun. I got to go on my own walk around town, and it was one of my first trips by myself. So it was just very cool. And again, there's the QR code for the fundraising page to learn more about them. But yeah. And then I got to partner with Julia Maderia for my second Boston Marathon partnership. So that was April 2024. So most recent, just happened, very exciting. But those are some very fun pictures that she sent me. Unfortunately, I didn't get to go to this one, but it was a great partnership. We got to talk a lot about, she works as a tutor for Westwood Public Schools. So she works with kids with autism, which is very similar to the work that my mom does. So we got to bond a little bit over that. She also gave me a lot of advice on school as I'm planning on starting in the fall. So she got to hear a lot of my nerves about school, and she made me feel better about starting. So I'm very grateful for getting to partner with her and another member of the Maderia family. She ran with my name taped to her shirt, and she knows that my favorite color is yellow, so she got the yellow tape, and she's wearing a yellow hat, and it was very sweet. And she did a lot of cool fundraising. So you can see on the left side picture that is a board that she printed out with a few pictures of me and just a little bit about my story. And she shared it around, and she had a lot of success with fundraising. So it was just really cool seeing what everyone chose to do with their different fundraising. But yes, so again, there's the QR code, but yeah. So finally, this is a little bit about kind of my more recent journey with Running for Rare. So Running for Rare on the move. So I was actually on a plane ride, and I was just sitting next to this lovely man right there, Eric, and he was doing a presentation about intestinal failure. And so as like with my rare disease, that's something that I struggle with. So I thought that I would just ask him about it. I decided to be bold, and I asked him about it. And so the whole plane ride, we just started talking about intestinal failure and rare diseases. And then he's a runner and I'm a runner. So then we started talking about running, and I was like, you should do Running for Rare. So then we started talking and more, and he said that he lives in Denver. So we got to talking about the Denver Colfax Marathon, and we came up with the brilliant idea that we should start a Running for Rare race for the Colfax Marathon in May of 2024. So then after my trip, I decided to reach out to some of my lovely friends that I made through Running for Rare. So you can see Jamie Pacheco and Philip and Sharon. So I'm very grateful for them, but we just got to talking, and we decided that we were going to kind of tackle the Denver Colfax Marathon. So that is coming up soon. It's been very exciting, and next slide, I'll tell you more about kind of my journey with this. So fundraising can be kind of daunting, but it can also be very fun. So one thing that we did was we just started spreading the word. We talked to friends and family, also coworkers. So something about me too is that I interned at a lab at the University of Colorado Anschutz Medical Campus, and which is actually a rare disease center of excellence, which I most recently learned. But so I found that out, and I was like, this is a great opportunity. So I sent out a community engagements email about rare disease and Running for Rare, and that we were going to do the Colfax. And so two of my friends from my lab, you can see on the bottom left picture with the three girls, that is Emma and Maya. They have been so amazing during my journey with this, and they helped me reach out to a few more work people. So they decided to become runners for the Denver Colfax Marathon. And then on the very left side picture, that is my mom. She is going to be doing the Colfax 5K with me. So kind of just we're building the community. It's been great. But one thing too is just doing flyers and events. So on the very right picture, that is a flyer that me and Eric made. Eric has a very wonderful printer in his house that is color printer, and he can print a bunch of them. So he printed a bunch of them for us, and we just started going around and placing them in different places. And Eric brought them to the rec center and to like coffee shops and just different areas in the community. And I started bringing them to like the children's hospital, and a lot of my appointments with me, I've bothered a lot of my practitioners with these flyers, telling them to hang them up. And I have been successful, which is good. But so we also, Maya and I, which is the in the bottom picture of the three girls, Maya is the one in the middle. Maya and I decided that we were going to start making homemade crafts and selling them for 100% of the profit goes to our fundraising pages. So we decided to go and sell our crafts. Maya made those earrings. There's a picture on the bottom. And then if you look in the picture of the table with the flyers, you can see my magnets in the little red basket. And my mom also helped me make the magnets. I will give her credit. She definitely very helpful. But so it was great. We went to a coffee shop and they just let us set up our little booth there and get some coffee and sit there for a few hours. I learned that people really like their coffee and not always liked to be hounded about rare diseases, but we still met so many good people and so many fun people. And so I just learned that don't be afraid to reach out. Everyone, if you tell them your story, they're very receptive to it. So yes, it's been very fun. So my next slide is how can you help? You'll see the QR code on the top right, and that will take you to the page. I took a screenshot of the page that it will take you to, and it is right there. It's how you can sign up to either be a runner or a community partner for various of the next runs that we have for Running for Rare. And then you can also see the Running for Rare everywhere or anywhere. It's the top one. And so you can create your own event just like I did for the Colfax, and it doesn't have to be like a partnership with the marathon. It can definitely be whatever level, whatever race that you want. It's really just starting to spread the word with the community. Yes, it's more accessible for more people and more places. And you can also join the cheer section for a race if it's near you. So it's just going to the races and joining the cheer section, cheering people on and taking pictures and just being there if you're not a runner, not a community partner, but just wanting to show your support in a different way. So yes, follow the link if you're interested. Ask any questions if you have any, but thank you guys so much for listening.
Thanks so much, Lily. All right, I'm going to introduce our second panelist, Irfan Patel. Irfan is NORD's Rare Action Network Delaware Ambassador. He is on Delaware Rare Disease Advisory Council and is being recognized as a 2024 Rare Impact Award honoree for his dedication to enhancing awareness and support for rare disease communities in Delaware through legislative advocacy and community engagement. And Irfan is going to present about getting involved with legislative advocacy in your state. And with that, I will turn it over to Irfan.
Sorry,
Sure.
Irfan, can I just steal a moment before you start presenting, Irfan? I'm sorry.
Yeah, sure.
I just wanted to announce we're gonna we have two polls this evening, so I'm going to post a poll that should pop up on your screen, and if you could take a moment and answer the poll, we'll leave it up for a few minutes while Irfan's presenting, and then we'll share the results later on. So thank you.
Yep. Thank you. Thank you, Darby. And thank you, Kristen. Hello, everyone. My name is Irfan Patel. My wife and I are blessed with 4 kids, and 2 of whom were born with a rare genetic disorder known as methylmalonic acidemia, MMA mutation 0. So this is a rare genetic disorder that affects where the patients are not able to process certain proteins and fats properly. And the effects of MMA vary from mild to life-threatening. And typically this condition, unless diagnosed through newborn screening, manifests itself in early infancy. So without treatment, the disorder can lead to coma and death in some cases. And as you see here on the picture, so my son Yusuf was diagnosed with MMA when he was 9 months of age, because at that time when he was born, in Delaware newborn screening did not have organic acidemia as part of the newborn screening protocol, so we missed that. So he had to go through a metabolic crisis to get diagnosed when he was 9 months of age. And then obviously when my daughter, who's my third kid, right, when she was born, they are about 10 years apart, right? When she was born, we had added MMA as part of the newborn screening, so we were able to detect it at birth. So as I mentioned, this condition has so many challenges, right? Obviously, both emotional and physical challenges as well. And both of my kids had to go through multiple organ transplants. Again, transplant is not a cure because it's a genetic disorder, right? But then to sort of improve their quality of life, we had to go through the transplantation journey. And then I had myself diagnosed with the rarest form of MMA called combined melanic and methylmalonic acidemia, CMAMA. It was a chance diagnosis in the National Institutes of Health a few years ago. So again, this is a rare condition, and there are only 50 documented cases worldwide of CMAMA, and there are so many unknowns. Unlike my children, I'm still I have not seen any impact of CMAMA on my on the physiology as of yet, but I've been told to keep an eye on any kind of potential or possible neurological impact. I mean, as I grow old. So that's about my rare disease connection, and obviously I have been very passionate about raising awareness on the rare disorder that my kids have, and in general to sort of create more awareness for the rare disease community. And I've been doing a lot of advocacy work, and I ran into NORD. It was again a chance encounter. I was doing research online, and back in 2013, I got involved with 2015, I got involved with NORD, and Kristen was my first point of contact. And since then, NORD has been like my second family. And back in 2022, actually 2021, I was appointed as the RAN ambassador for the state of Delaware. So I have been focusing more on the advocacy work as well as community outreach kind of programs, right? But again, today I'm going to talk mainly on the legislative advocacy piece. So basically, what is legislative advocacy, right? I think one platform that I have used very effectively is through legislative advocacy, right? We're all passionate about raising awareness and creating a level playing field for the rare disease community, right? And one effective way of doing this is through influencing and developing policies that are conducive to our community, right? As we all know, legislative advocacy is a process, right, where we are able to influence the development and implementation of policies that's going to help achieve our specific goals, right? Again, specific goals of a rare disease community. So, and again, there are many levels of advocacy. I will talk about my journey in a minute, but I just want to highlight one thing here, right? Typically, when we think of legislative advocacy, we always think of federal, right? Which is also important, right? That's where we are able to make an impact at the national level. But then there are also multiple levels of advocacy that requires our attention and participation, right? Which is at the state level and county, and in some cases, advocacy at the township, even school district, right, is also equally important. So, I mean, think of it this way, right? As a patient or the caregiver of your loved ones, right? As you step out of the house, every source of interaction, whether it's the school or municipalities, like workplace, places of worship, community events, each one of these sources of interaction creates a need for policy change. So that would be next slide. Yeah, thank you. So now the question is, what does it involve, right? Again, of course, it goes without saying, right? The first component of this is direct communication with the legislatures, right? This involves contacting your lawmakers and legislators or government officials directly, so we can advocate for a particular position, right? Policy or piece of legislation, right? You will meet with the lawmakers, attend legislative hearings, right? Submit written testimony where they are being sought, right? Or even engage in some form of direct communication to convey your message. So in addition to that, the other most important component is grassroots mobilization, right? This involves mobilizing individuals or groups within your communities, right, to advocate for specific legislative goals, right? Basically, we have used grassroots advocates, right, to organize letter writing campaigns, right, phone banks, and other activities to demonstrate public support to particular policies, right? And the third one, I won't go through all this here, but the other one, third one that I want to highlight here is a coalition building, right? And as Lily mentioned a few minutes ago, right? It's very important to build that broader network, right? A broader coalition, right? So the advocacy work becomes more impactful, right? So typically, when you talk about coalition, when you think of coalition, the most important thing is you need to make sure you bring like-minded groups, right, to amplify our voice and increase the collective influence. And again, by working together, right, we are able to pool resources, share expertise, and coordinate advocacy efforts, right, to achieve our common objective. As we all say, right, the more the merrier, right? But the most important thing to keep in mind here is we need to align with groups that share our objective, right? So again, as you see here, right, there are also other components here, like research and analysis, right, and legal and policy analysis. But if I had to pick the top three, those are the top three components, right, that involves in legislative advocacy. Overall, right, legislative advocacy is the most powerful tool, right, for driving social and community kind of change, policy change. So if you go to the next slide here, yeah, thanks, Darby, right? So our journey in Delaware, right? So what are the key takeaways, key highlights of our advocacy journey in Delaware, right? So we started to work on introducing concurrent resolution in our General Assembly, right? Both our state Senate and state House of Representatives, to recognize Rare Disease Day every year, and we have been doing that since 2013, right? I think that piece of that particular event is so important because that's where you're able to share your objective and your cause, right, to in front of all the legislators who really devise policies that's going to impact each one of us day in and day out, right? That's such an important platform. So as I think one, from my experience, one thing I would like to highlight here is when you're trying to conduct these kind of programs, right? I mean, work with the General Assembly in your state on these concurrent resolutions, you need to be flexible, right? So basically, for example, in our state of Delaware, our house is always in recess starting mid-February until mid-March. So that means we are never able to do this event on the Rare Disease Day, which is the last day of February. So what we do is we have done this in January, right, before they go on recess, or in March. So you need to be flexible. And again, flexibility needs to be there, right, when you try to coordinate these kind of programs. And the other thing to keep in mind is, in some cases, as you see on the picture here on the right side, a couple of years, sometimes we are given access to sort of put a table, right, and sort of, so we're able to host NORD table at least like 3 to 4 times, if I recall correctly. And sometimes you're not able to, you don't get that option, right? But you are able to go to the General Assembly and then be present when the resolution is passed, right? So you got to be flexible. And then, as you see here, one more picture there, right, the bottom half. So this was the COVID time, right? 2021, 22. So we had to do everything on Zoom, right? And we didn't miss it, right? We said we had to host the event, right? But it has to be virtual. So you got to be flexible. That's one thing I would advise all of you to keep in mind. And then we also were successful in working with our governor, right, to sort of introduce proclamation on the Rare Disease Day. And then we have also worked with our county executives. So I think this is a different structure. I don't think we have this structure in every county, right? So in our county, we have a chief executive of the county. So I've been working with his office to introduce proclamation on Rare Disease Day. And then the most important thing is, right, and I call it the feather in the crown of our legislative efforts has been the establishment of RDAC, right, Rare Disease Advisory Council in our state. Last year, on July 26, 2023, our Governor John Carney, he signed the Senate Bill 55, number 55, establishing Rare Disease Advisory Council. And obviously, and the job is not done yet, right? So this is a journey. The real impact measure would be on how we are able to influence our state report card, right? That would be our true true North Star, right? We'd like to see A's across the board, right, in our state card. Yeah, so I'm not sure how many of you are here from Delaware, but if you're from Delaware or even from neighboring states, right, the tri-state of Maryland, Pennsylvania, New Jersey, or anywhere in Northeast, right? Or for that matter, if you are associated with NORD in any shape or form across the country, right? Please do like our page, right? We do have a Facebook page, and then my email is right there. If you have any more questions, please feel free to reach out to me.
Thanks so
Yeah,
much,
that's all.
Irfan.
Yeah.
All right, so I'm going to introduce our next panelist, Abby Villarreal. Abby is a senior in high school from San Antonio, Texas. Throughout her high school career, she has been engaging in increasing awareness and education about rare diseases among her peers in her high school and within her community in Texas. Abby is also a 2024 Rare Impact Award honoree and will be presenting on how she has raised awareness for rare diseases by participating in Rare Disease Day events and through her extracurricular activities. And Abby, please feel free to unmute and take it away.
Hello, everyone. Like she said, my name is Abigail Villarreal, and today I'll be talking to you guys about Rare Disease Day and also Light Up for Rare and how I was able to do a lot for my local high school and community. So just a little bit about me. I am a rare disease patient. I was born and I had gastroparesis. And I also did my newborn, well, they did my newborn screening and I was flagged with phenylketonuria, which for short is PKU. I have a different strand of it, which is hyperphenylalaninemia, which is hyperphe. So PKU is something I continue to live with and I will live with it the rest of my life. So my family first learned about NORD when I was really young from the doctors, but I did not become involved with NORD until my freshman year of high school when I was creating my pageant platform. And so I advocate to spread awareness about this organization, the resources, and just to educate everyone as I can. So a little bit about my extracurricular activities. In 2021, I was crowned Miss Reina Latina San Antonio Teen. So a little bit about this platform, pageant, it's a little different. So we had to do an interview, and one biggest thing for our director was each of us needed to advocate for something. So my platform was Be Rare, understanding, educating about the rare disease community. So I would go out into my local community as a queen, and every time someone would ask me, what's your platform? I would tell them about it. And I would say, if you want to learn more about it, or you want to donate, or you just want to be part of this community, there is NORD, National Organization for Rare Diseases, and you can learn a lot more about it. So that's kind of what I did with my pageant platform. So I planned a Be Rare Spirit Day starting sophomore year. So I did a sophomore, junior, and senior year. So this is my last year doing it, which is really sad. But I planned and organized and hosted an event at my high school. My goal was to spread awareness about rare disorders to students and staff at my high school. So my sophomore year, I actually handmade awareness ribbons with my mom, and we made so much. It was 100 yards that we used, and that's the length of a football field. So I love saying that to people, and it's also on my resume because it's just really cool. It's like I made so many ribbons. It was a length of a football field. So these are just some pictures of people that have participated. I didn't really think this was going to be a really big thing at my school, but every year I'm always asked to do it again. So I have some girls from my dance studio that were able to participate, and a lot of pictures of just people at my school. There's one picture with the zebra in it, and I know I showed Darby this, and she really liked what it said under. It says, "Please don't feed the zebra." That is at my doctor's office. These are my dietitians that are with me, have been with me since I was little. And again, just some more pictures of me. Some of these are from sophomore year, and some of these are from this year, and this is at my local dance studio. So right here are some blogs that I was part of my sophomore year. I reached out to a lot of reporters and just trying to get the word out about NORD and Rare Disease Day and just having people participate. And the Children's Hospital San Antonio did a blog on me, and that was really cool because I was born there and they're the ones who told me I had PKU. So that was really cool to be part of it. And also Ken's 5 is a local news station here in San Antonio, and they did a story on me. So, County Judge Rosie Spidlin, I met her at a networking event when I was Miss Reina Latina, and it was really nice. My mom actually showed me this. She posted on Facebook about Rare Disease Day when in 2022, and it was really interesting and cool to see her do that because I never asked her to do it. I just told her about rare disease, and she was really interested in the community. So it was really nice to see her do that. And also KRN public TV news station, they actually posted something on Facebook as well about Rare Disease Day. So Light Up for Rare is another project that I have worked with. So I use the template that Light Up for Rare gives us, and I was able to recruit local businesses and buildings to participate in this campaign. Some of them that were able to participate is a pyramid building, Alamo Quarry, Frost Tower, I believe I had a hospital as well. Yes, the Children's Hospital, my dance studio, Henry B. Convention Center, and then again the Pyramid Building. So a lot of these you see like once or twice. They've actually stuck with me since sophomore year. So every year I'll email them and ask, "Hi, are you going to be able to light up for Rare this year?" And they're like, "Yes, we already have you on the calendar." So I was able to make that connection with them, and they've done it for about 4 years now. So my personal project is the thing that started a lot of my advocacy work at my local high school. We had to do a personal project, and I was really stumped. It's like, I don't know what to do. And so my mom's like, why don't you do something that you know a lot about, but you can learn more about? I was like, okay, so PKU. So I decided to do a project just on PKU until I started researching more and I found NORD. And I was like, wait, there's a lot more disorders and rare diseases that people don't know about. What if I just make this a whole rare disease project? So my poster is called I Am Rare. And I wrote a 12-page essay about my advocacy work and just how I got started. And that's the one thing that helped me get my Rare Disease Day at school. My sponsor, Miss Love, and I went up to the principal and we're like, hello, like this is for my project. Am I able to host a spirit day? And he was like, oh yeah, of course. Like, I'm so okay with you doing that if it's going to bring the community together. And I'm really glad a lot of people liked it. And now, since I'm graduating this year, someone who's a junior, he has no connection with the rare disease community. He just loved that I was bringing connections for this, and he asked me to help him just get in touch with everything. And he's going to take over my project for next year. So he will continue the Spirit Day. And I gave him all the resources I had from NORD and was like, these are all the things I printed out every year. It was like, if you want to take it, here you go. Like, go to this website, go to this website. This is what you do. And he's like, wow, this is a lot. It's like, it is a lot, but it's worth it. It's really worth it. And then some of the accomplishments that I have gotten, I've gotten a certificate of appreciation from City of San Antonio Council District 1 Councilman, from the councilman, and also I received the same certificate from San Antonio City Council District 7. And I've also gotten a proclamation from City of Balcony Heights declaring February 28, 2022 to be Rare Disease Day, and also Methodist Children's Hospital Ken's 5 2022 Champions for Change. And my newest award is a 2024 NORD Rare Impact Award honoree, and I am the first ever youth champion awardee. And these are just some pictures of me speaking at the Balcony Heights presentation that they had, as well as a picture in front of City Hall with my sorry, I lost the word, but with my awards that I got in. And then again, these are just 2 other pictures of some other awards I've gotten.
Thank you so much, Abby. I had like the biggest pleasure meeting Abby and her family, her mom and her dad, when I was in San Antonio traveling on behalf of NORD earlier this year. And they're just all incredible, and the work that Abby's done is incredible. So thank you so much for that presentation.
And then I had to say one more thing. I'm so
Sure.
sorry. It
Sorry.
totally slipped my mind. So in the beginning of my slide presentation, I have a picture of me in a orange dress. I am a flamenco dancer, and I have two dresses. I have a blue one, my first ever one, and I asked my mom for a second one, and she was like, "Why?" And I said, "I need something to help with my platform." So the colors on my dress are orange, green, purple, pink, and blue for rare disease.
I love that. Thank you for sharing. I'm going to introduce our final panelist, last but not least, Tammy Jones. Tammy is NORD's Rare Action Network Arkansas Ambassador. And Tammy has been our Arkansas Ambassador since 2018, and she's been instrumental in building a presence for the Rare Action Network in Arkansas. And she's going to be presenting on the Ambassador Program and her work in community engagement, advocacy, education, and awareness. And most importantly, Tammy is a caregiver of 5, a mom of 5, and a nana of 7. So Tammy, I see you're unmuted. Please take it away. And I'm actually going to unshare the screen, and Tammy's going to talk to everybody directly.
Hello, I am so honored to be able to be part of this webinar. I'm just right now overwhelmed. All the wonderful things that I'm hearing that are going on in other states, and what a great job you guys are all doing. You're going to kind of hear, I think, as I share a little bit about how I came to be part of NORD and a little of my story, and you're going to see how we're all just in a great big unit, you know, just like he was talking about a little earlier, a coalition. I was just sitting here going, oh my goodness, it's going to all wrap up. So how I got involved with NORD, it's been almost 6 years now. I actually was contacted by a previous ambassador who had met me, and she mentioned to me that Arkansas was going to be needing an ambassador. She said, "You're already doing the work, so I think you should apply." So I began my NORD discovery in 2018. I completed my training and application while in the hospital with my husband for 7 days. I didn't spend all 7 days working, but I was able to complete everything there. Made a good use for awareness even in that situation. For many years, I've been advocating in my community for von Willebrand's. I have 5 family members with von Willebrand's bleeding disorder, and I was diagnosed late, and so it affected me and with a lot of unanswered questions as I was growing up. I was in my 30s. I had given birth to 4 children with a lot of bleeding following my births and monthly, with severe pain at times that would just really, I would double into. Yep, I was told it's normal. So our diagnosis was actually found when my 11-year-old daughter began to have severe nosebleeds that we couldn't get under control. After 2 cauterizations, I knew this was not normal. We went for testing, only the females, of course, because at that time it was said that men do not have VWD. I found out that we all have VWD, and I was also a carrier as well as being affected. This took a very hard toll on me because all I could think of at the time is I'm passing this on to my children and my grandchildren and my great-grandchildren. Not that I could do anything different because it had been given to me, but it was still something that impacted me, and that's a lot of the reason I became an advocate. So we went on for testing. When we found out that we all had VWD, I was the carrier. Well, in our state, there was only one hospital, doctor, anything, around that tested or treating von Willebrand's, and that was Children's in Little Rock, Arkansas, which was a 3-hour trip for our family. So as my little ones were growing up, we would spend a full day in clinic at Children's Hospital. So when one of my affected daughters had a son, we strongly suggested he be tested before they did the circumcision. So most probably his life was saved at birth because of the diagnosis we had finally gotten. At 6 months old, he had a circumcision as an outpatient, and even with treatment, he seeped for 1 week. So we were, of course, very startled and very scared because all of us were kind of older before we knew. Well, my advocacy began because I didn't want anyone else to suffer with unknown answers, with symptoms like I'd had growing up, only to be told it's normal. I learned this disorder went back to my great-great-grandmother. My mother, she refused testing. However, as I became one of her caretakers through the year, who she now has dementia, I saw that on one of her doctor's comments that she had bleeding issues. So that kind of let me know that more than likely my mom also had the same bleeding disorders. As more patients were diagnosed and the advocacy began, many years later, we can actually look up and find more than one sentence on VWD, which is all I could find when I was first diagnosed, which also would have been my 3 children. This is a rare disorder, and I only learned 4 years ago on a virtual conference during COVID that our bleeding disorder was a rare disorder. This is a rare disorder I learned affected so many people, 1%, 1%. And that's, I believe, the last advocacy that I heard story, it's 1 in 100. So as you can see, it is well spread, but it wasn't known a lot about. I'm sorry, I lost my place. Like many, testing can be difficult. It can be missed or it can be ignored. My personal opinion is most healthcare workers are not comfortable with rare disorders, and understandably so. However, as brilliant as they can be with the book knowledge, I think sometimes there's a blind ignorance of understanding some of the rare cases that they see. And that's tough. So that's where our advocacy comes in. I really don't mean that negatively. It just really is, it's really tough. And it's hard to say, I don't know, when you're a doctor. And we just need to continue our awareness and advocacy. Well, this is why we need that patient advocacy and awareness. And that's why it's so important. It's important to encourage our family members to get tested no matter what their age. I did run into that at several conferences. I was approached and said, I'm this old, but I don't see any reason for me to be tested. Well, that's how the data saves lives. Then one of the other questions that they were asked me to speak about is, why become an ambassador? Well, to bring awareness home for a closer impact, then to share your rare story or your journey. We do this by working through our personal needs and connecting with others. Connecting with others in our life is very, very important. I've had the opportunity to be an ambassador in my community, my state, and with federal policy. I have worked with Students for Rare and shared through virtual meetings to share about NORD and help for resources to answer unanswered questions, which some of you might be familiar with and have heard. Why are you acting so strange today? You're tired a lot. You're cranky. That's just not the usual you. Why do you sometimes pull back from doing things? And sure seems like you go to the doctor a lot. I'm sure some of us in this rare community have heard those questions because we just aren't comfortable sharing, or because we don't know exactly how to start or how to do that. Well, the impact for me has been connecting with others through events, and those events have led me to partner with the local medical college for Rare Disease Day, where I met professors, geneticists, medical students, and then connection with the new research center that opened in March of 2023, where I was able to host Rare Disease Day 2024. You know, I began thinking when I started that I needed to start at the top, go to legislators, and I did. That was one of the first things I did. I went to my local legislators, and they were just changing offices, so I met the new ones, And I also got to meet the ones that were going out of office. So I thought that that was going to be the most important thing. And absolutely, that is very important. But what I found is more doors opened when I brought it home to my community by setting up NORD tables. I did my first one in a fall festival, and then I attended reorganizational events. If I found out about it, or if I heard about a health fair, I wanted to be a part of that. Some of us are just not real comfortable with that, but it is so rewarding when you just step out there and do it. Because the first time a medical professor walked up to the table and said, "Tell me what do you know about rare diseases?" You know, I knew of a few, and from that I have learned so very much over the years. So, you know, if you attend events, then you can kind of see what they do. Start simple in that community. Go visit some of the vendor fairs that come through, or anything that happens in your community. See what they do on tables. See how they interact with others, and start to share whether they're selling something or whether they're just giving out important information. And I also found that anytime pretty much I set up a table, it's free. It's not going to cost you anything. And a lot of that is because they hear what we're doing and they are amazed. And the majority of the time, I will find there's a rare patient somewhere in that family. So my RAN group, well, it continues to grow, not only in number, but in learning how to share our journey. Sharing our journey is one of the most important things that we can do. One of my girls said in the RAN group when she joined, was very shy, and she said, I said, "I would like for you to share your story at Rare Disease Day one day when you're ready." And she's like, "I wouldn't know how to start my story. I mean, how do I start that? How do I do that?" So with all the challenges that we had faced together, I said, "Well, how about share your journey?" Everybody has a journey. And you know, that's the thing with our story, or whether it's our journey, we can't mess it up because we're the one that lived through it. And all we can do is share with others how they can overcome. So with that, and learning how to share our journey together, I'm finding treasures in others that are ready to become ambassadors from NORD. That is what it's all about. It's what it's all about. Here's how others can get involved. Learn to advocate, even if that means stepping outside your comfort zone. Many of you are already advocating and you don't even realize it. So let me just tell you what the definition is that I look at for advocacy. It's defined as any action that speaks in favor of, recommends, argues for a cause, supports or defends, or pleads on behalf of others. Every single day, every one of us are being an advocate in some way or another. So we're already doing the work. Let's just put it all together. So what can you do? Put your story or your journey together, just like we've heard tonight. Share it with others. Be thrilled to share it with others. Attend community events. And like I said, watch those vendors, see what they're doing. And you see a table behind me. That was one of my very first at a health fair. Went over tremendously well. And of course, as you can see, the zebra cakes always have to be a part of them. We feel empowered when we learned. Remember, knowledge is power. Recently, a college student shared his rare story for the first time and left us with this quote. He said he could relate his rare with it. It was from Michael Jordan, and it says, "If you run into a wall, don't turn around and give up. Figure out how to climb it, go through it, or walk around it. That's why we work together as teams to bring awareness and advocacy about NORD and rare diseases." Thank you so much.
Thank you so much, Tammy. That was really wonderful. And I apologize to everybody. It's getting darker and darker. It was light when we started, and now it's pitch black in here. So it's just funny because I promise you I'm not sitting in here just in the dark doing this. that was really wonderful. And Tammy, like she said, like I said at the beginning, has been an ambassador for so long. And I'm just going to share my screen so that way you can see some of the opportunities to get involved with NORD, one of those being the ambassador program. And both Tammy and Irfan, I think their emails are on available and would love to share more. I think I can speak for them in saying they'd love to share more about the ambassador program if you're interested in reaching out. So hopefully you see my screen. Here's information on reaching out to Tammy. Here's her email address. And Arkansas also has a Facebook page. Very quickly, I'd just like to mention some volunteer and advocacy opportunities. Of course, there's the ambassador program. There's signing up for our Rare Action Network, which is the best way to get involved with advocacy at NORD. We have our Students for Rare program that's open to high school, collegiate, both undergrad and medical students. We have our Running for Rare program that Lily spoke about. We have a lot of opportunities for community members to lead fundraising efforts to benefit NORD. We have some in-person office support opportunities, and we have project-based roles. One of a big significant need for project-based role coming up is volunteers at our Living Rare, Living Stronger Patient Family Forum that's coming up in Los Angeles. We have a lot of on-site volunteer opportunities. So if you're interested in that, please reach out to action@rarediseases.org. And I believe Kristen should also be putting the link to our volunteer form into the chat, so you can fill that out if you'd like. And with that, I just thank you all so much for your time tonight. And thank you also to any volunteers on this call that have been engaged with NORD in the past. Like I said at the beginning, it's National Volunteer Month, and we are so lucky to benefit from the support of over 1,000 volunteers annually. They really drive our mission, both nationally and locally in their communities. And our reach is so much further with their support. So thank you to all of you for your interest in getting engaged, and thank you to those of you that already are engaged with NORD. And I hope you all have a great evening. With that, we will conclude. Sure.
Sorry, I know we're at time, but if those of you that want to stay on a moment longer, there were just a couple of questions in the Q&A. So one being, somebody asked, if you become an advocate, does NORD provide the resources for a table at an event for you to represent NORD? Unfortunately, due to the number of advocates we have nationwide, we're unable to provide printed materials to everybody. However, that being said, we have an array of materials that are digital that you can have printed locally or distribute digitally for our advocates, and we do send materials upon request depending on the situation. So always ask, and we're happy to accommodate if we're able to. And if those of you that did want to linger a couple minutes, we did have a question for, I believe it was for Lily about selling the crafts, and she wanted to know how the ideas for selling the crafts and connect with you on those ideas. She thought it was a great idea.
And to whoever asked that question, just so you know, your name came in as Darby Gavin. So we would love to connect you, afterwards with Lily, if you'd like to, because I see you mentioned that in your question. Unfortunately, we just don't know who you are. So if you could just let us know, Action at Rare Diseases, we can get you connected. And Lily, if you'd like to kind of share how you came up with some of your ideas, that would be wonderful.
Yeah, definitely. So actually, my mom is super into sewing, and she used to have a business sewing clothes. So I kind of had that background. And so when I was talking with my friend Maya at the lab, we were just talking about crafts, and she used to work for a jeweler, yes. But so we were just thinking about different ideas and different things that we could do on top of the fundraising page. And we just came up with the idea of making some crafts, seeing if people were interested. And the coffee shop that we were able to sell our crafts at, they actually, it was just they were very sweet, and they were really excited about inviting in vendors. So we were just able to go and set up our booth and talk to everyone who walked by, and it was just a really great opportunity. But I have found that just if you're willing to reach out to different places in your community, they're usually very, very excited to help you. And so, yeah, we're hoping to make an Etsy page. It's kind of complicated, but we're trying hard. But yeah, so whoever asked that question, I definitely love to connect and talk more about the crafting. So yeah, thank you for asking.
Thanks so
Lori.
much. Thanks so much, Lily. And I should mention we have another really creative Running for Rare fundraiser that Jamie Pacheco, she's our staff partner for Running for Rare. Correct me if I'm wrong, but I think it's still live. There's a runner that is selling banana bread. And it's a business that she has, and for a designated amount of time, all of the proceeds are being donated to her running fundraiser. So maybe we can send that out in the recap, the link to that in the recap email if anyone's interested in some banana bread. And I believe that there was one more question in the Q&A. There was a question about a media kit. We do have kind of media solicitation templates. I think that they're on our Rare Disease Day website. That person, just so you know, you're also listed as Darby Gavin. So if you could just send your inquiry to Action at Rare Diseases, we'll make sure we get those links to you, and we can also include them in the recap email. Yes, somebody submitted a question asking if a summary of the questions will go out. We can definitely pull that together and include it. And then somebody, if we do a fundraiser online, can the money go directly to NORD and not us? How does that work? I actually would love, and Jamie, if you're available to answer that question. Jamie's on our development team and does a lot of work with community members that fundraise for NORD.
Hi, yeah, so there's a couple options, depending on what it is, and you're welcome to reach out to me through Kristen and Darby and Rare Action, and they'll pass it on to me. But we have a DIY page, so you can set up a fundraising page, and it can go, say you're selling a bracelet, and the bracelet can go, the money can go on the website. Like people can buy, you can be like, oh, you made a $5 donation. Okay, here's your bracelet. And if it's a little more specific, we can possibly create a fundraising page for you. So hopefully that helps out a little bit, but yeah, open to communication and helping out anybody that needs it.
Thank you, Jamie. And then I think the last question Kristen already answered earlier, it was a question about providing resources at tables. I think she said all of those materials are available online. And I will say, if you're really interested in advocating and mobilizing people in your community and getting involved to the degree that our ambassadors are involved, like Tammy and Irfan, we do have materials available for our ambassadors, and you can reach out to Action at Rare Diseases if you're interested in that role, or you can apply through the volunteer form. And then I think that those are all the questions that I see in our chat. So I think it's safe to conclude now, and thank you all for staying on. We appreciate your time, and keep an eye out for the recap email. And I see the comments about being named Darby Gavin in the chat. I'm so very sorry about that glitch. Thank you for bearing with us. And the poll is still open. The second poll question did deploy. So if you'd like to answer that before you sign off, you're welcome to do that.
Thanks,
Thank
everyone.
you. Thank you
you.
all. Have a nice
Bye-bye.
night.